Welcome to a special Healthy Smile Rejuvenation edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thank you for joining us. Today we take a look at the latest information available on healthy oral care, controlling pain and sickness now known to be caused by dental concerns. If you have metal fillings, bleeding or sore gums, even persistent headaches or continuing pain, you're about to find out something that could change your life. So stick around. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
In studio today, we have the dentist that everyone's talking about, Dr. Kerry O'Reilly. Dr. O'Reilly is considered by most to be one of San Diego's leading authorities on healthy dental care and TMJ disorder, the pain caused throughout your body by misalignment of your jaw joint. Dr. O'Reilly graduated from the world-renowned Duke University and went on to get his DDS at the USC School of Dentistry. Dr. O'Reilly's true passion in life is helping people get out of pain. Dr. O'Reilly, welcome to the show.
Thank you for having me.
Okay, I brought you in today to talk about a little bit about healthy dentistry, metal fillings, little gum disease, and TMJ. But before we get into that, tell me a little bit about what led you to this form of dentistry, because I know, I read a little about you, that you had at one time a huge dental practice, and for some reason you let that go and went this way. So tell me why, please.
I actually did. I had 6 dental practices at one time, about 10 years ago. That was the first half of my dental career, so to speak. I had doctors working for me, doctors, specialists, other dentists. I learned it was very stressful. It's very stressful to do that, to do dentistry as a business, where you're looking at the looking over other doctors at the bottom line, and I found that the enjoyment of doing dentistry left.
Because you were no longer really dealing with the patients, you were running a business.
Exactly.
Okay.
Also, during that time, I found that I started developing health problems. I started developing chest pains, a lot of sensitivities myself, and I needed to find out what was going on with me, because it's bad enough to actually threaten my practice of dentistry.
Right.
So I actually ended up in the hospital a couple of times with chest pain, severe chest pain. So that started me looking at what I needed myself to stay healthy.
All right. What did you find about dentistry that may have contributed to your problems?
I found basically that dentistry is a toxic profession. There are things in the dental office that are very toxic to us. Chemicals, a lot of chemicals, and a lot of metals as well. When you're doing dentistry, when you're placing fillings or crowns or removing them, there's metal that's released into the environment, into the office.
You know that one of the main reasons I brought you in was for that exact reason. I had my metal fillings taken out years ago and composites put in. At that point in time, I did it for cosmetic reasons, because I think opening your mouth and having a bunch of black teeth looked horrible.
Sure.
I've found out over time, and I don't get a lot of people that are willing to talk to me about it, but you agreed to come in and talk to me about it. Metal fillings have mercury in them.
They do.
All right. Mercury is considered, and again, this is my feeling, is considered by the state of California, about everybody. I mean, you read about mercury poisoning all the time. It's considered a toxic. But when it's in your mouth, it isn't. Is that fair to say?
That's basically true.
Okay. Is there a possibility then, and I'm not a possibility, that the mercury in those fillings could be getting into my bloodstream, could I be slowly getting mercury poisoning from my fillings?
That's a good question, and that's the controversy. That's the debate about mercury in your fillings. There's differing opinions about that. There's about a drop of mercury in each one of your fillings, and it is regulated by the state of California, for instance. It's considered a hazardous waste, a biotoxin, which means it's bad for us. It's poison in our bodies.
But this is, and this is another thing. So medically speaking, we move along at a pretty fast clip. New things come out, new procedures. You don't have to cut the shoulder open. Stuff comes out all the time that's brand new. Arthroscopic surgery. 20 years ago, people told you, well, you're crazy, it'll never happen. And now it's the accepted norm. There's a lot of new stuff coming out. You told me that the same metal fillings that are being put in now have been put in for 150 years.
That's true.
isn't there anything newer, better, maybe safer? I mean, does the metal, when you put it in the tooth, because there's so much to cover with you, when you put it in the tooth, you say it doesn't attract a tooth. Can it cause other problems by expanding and contracting?
Absolutely. The main problem with the silver fillings is that over time, it does contract and expand slightly, microscopically, to chewing, pressures, to temperature like hot tea. And over time, that will crack your teeth. It will cause little hairline cracks.
And a piece comes off. Because I actually lost a tooth because it cracked with a filling in it, and I just thought it was bad.
Very common.
All right.
It's like a crack can actually grow in your tooth over time until the tooth breaks.
You brought some pictures, and I asked you to bring some examples. So let's take a look at the first one, and tell me a little bit about what's going on in this picture. Okay? So what do I see? I mean, obviously, other than looking horrible, what's going on?
These are quite old. These are old silver fillings. They may be 30, they may be 40 years old. Over time, what this is showing is that the fillings are tarnishing.
What's going on with that front tooth? Why is it, is that tooth just discolored from the rest for a reason?
The tooth on the right, that's the largest one. The tooth is actually breaking and chipping around the filling, and you can actually see a little bit of the filling.
Is it brown or gray like that from the...
Exactly.
Okay.
That grayness comes from the filling inside of the tooth.
So it's actually seeping in and discoloring the tooth.
Yes,
That's
it does.
horrible, and it looks like it's chipping off around the edge, that gray one on the lower there by the filling. It looks like it's starting to chip off.
Yes, that's what's
happening. Is that a
happening.
common thing?
Yes.
All right, the next one that you brought is, to me, I now understand why my tooth broke. So tell me about that back tooth. What's going on there?
This is very common, what I see in the practice. There's a lot of, these are old, they are tarnished again. There's a lot of wearing on the teeth from chewing. But what you see is the cracks around the fillings on this one.
Well, that back one looks like there's a crack that comes out off the front, and then one that goes up off the top. It looks like that top right-hand piece of that back tooth is completely broken free. And that's what happened to me. The piece came out. And then I had to get a root canal, and then I ended up losing the tooth, and I had to get an implant. So
that can happen.
Had I caught that before it happened, do you think I could have saved myself that trouble?
Yes, in most cases. If you catch it before the tooth breaks, it's always better, because you can save more tooth structure that way.
All right. Now, this next picture you brought actually shows a tooth that has broken. Is that correct?
Yes, this tooth actually broke. You can see the back half has just chipped off or broken off.
And obviously, this person, from the metal that I see on the other teeth, has had problems before.
Exactly.
So traditionally, dentistry would have went in, either done a root canal and put a crown. Now, doing a root canal kills the tooth, right?
It pulls the nerve out, it basically kills the tooth.
Or they put the metal structure on it. Now, what did you do for this person?
In this tooth, you can see the crown behind it. That's what the patient had done prior. I removed the silver filling after the tooth broke. So this is what's left after the filling is out. You can still see the stain that remains in the tooth from the filling itself.
Now, what did you do instead of putting on a crown?
Once we remove a little bit more of that stain, what we do is we bond in, we call it an onlay. It's a mini crown. But now it's not a full crown.
So this is what you did to the tooth. You made this tooth look just like the tooth next to it without killing the root.
Exactly.
And without grinding any more off the tooth.
Exactly.
All right. We're going to have to take a quick break. When we come back, I know you brought some more photos. I want to look at them some more. I want to talk to you about gum disease, because your stance on gum disease is completely different from most I hear. And I want to talk to you about TMJ and helping people get out of pain. You've been watching Medical News Network. I'm Mike Wiggenstein. We'll be right back.